We have new bed cords that we're going to be utilizing. These are magnetic bed cords that are going to help improve our communication with Responder 5, which will ultimately help patient safety. So in order for these to work, we do have to have this plugged into the wall. In order for this to work, we need the bed cord to connect to the wall unit. And in order to do this, we have to have arrow to arrow, and you can see that the magnetic strips connect to one another. If for some reason we accidentally place it the wrong way, where you see there's no arrow on the side, it's not going to connect, and therefore it won't talk to Responder 5. So we just need to make sure that when we're connecting this, we are connecting it arrow to arrow. When we're ready to move a patient out of the room, we will disconnect this. Once the cord is removed from the wall unit, it is going to communicate with Responder 5 to let us know that the bed is no longer hooked up, so we will need to come over here and disable our alarm on the wall. With these new magnetic cords, we have some added safety features. Our patients can now go ahead and utilize the call light on the side rail of their bed. So in case their call light falls on the floor, this will now communicate with Responder 5 outside of the room. Another safety feature with this bed, with the new cords, is that we're going to be able to tell which room the bed alarm's coming from through the communication with Responder 5. So in order for this to work properly, we are going to need to utilize the zero out button to zero the bed out first before the patient gets in the bed. When zeroing out the bed, you're going to go ahead and click the zero button. You want to make sure that you have your sheet, your pillow, your flat sheet, and the SCDs on the bed already to account for that weight. You will not touch the bed at this point. Once it's zeroed successfully, then we can utilize our bed alarm. So we can see that our bed alarm is on, and when our patient is trying to unsafely get out of our bed, the alarm will go off. We will have to disarm the bed alarm, and then we will come over this way back to our call light and disable it from Responder 5.